Hello, my name is Kaylee Steele. I am a student physical therapist and physical therapist assistant. This presentation is on fall prevention and improved balance. The objectives we're going to talk about today are fall statistics, fall risks, prevention strategies for falls, improving balance, strength, and gait, and then lifting and carrying strategies. When we talk about fall statistics, it's important to know that 1 out of every 3 people over the age of 65 fall each year. When you're 72 or older, you start to fall every 2 years, and then after the age of 80, you can expect somebody to fall every year. 95% of broken hips happen because of falls. This tends to be they fall to the side, they land on that hip, and that causes a fracture. The fracture is like the most serious injury from these falls. Because of falls, it's costs the healthcare system in the United States $50 billion, and that's from about 3 million ER visits every year due to falls. And every 20 minutes, an elderly person dies from a fall, and many more are injured. More fall statistics. Deaths due to falls are higher among men than women, and the difference just increases with age. More women than men will experience a slip and fall injury. Men tend to fall because they climbed on something or they attempted a more risky activity. Floors and flooring materials are involved in over 2 million falls per year. The most common cause for a traumatic brain injury is a fall. Over 15,000 people over the age of 65 die per year. It's the second leading cause of injury-related death in the 65 to 84-year-old age group, and the first leading cause of injury-related death in those over 85. So let's talk about fall risks. There's intrinsic and extrinsic. Intrinsic are those that deal with us individually. Extrinsic are more like the environment and things that we do or participate in. So intrinsics are our age. If we've had previous falls, the state of our muscles, so muscle weakness or inflexibility, walking difficulty, poor vision, a fear of falling in our past medical history. Extrinsic factors are the slippery surfaces or footwear and clothing. So if you have jeans or pants that are too long and you scuff your feet, that's a fall risk. If you're wearing shoes that are too tight or too loose, you're not getting the best input from your nerves. Obstacles and tripping hazards, lighting, stairs, lack of grab bars throughout the home, medications that a patient is taking, and the improper use of the assistive devices. So how do we talk about fall prevention? First, we have to identify those areas of risk in our lives. One being the improper use of assistive devices. So whether you're using a cane, crutch, or walker, making sure you're using it properly. Making sure you don't have slippery floors. So especially as we use the bathroom or we do dishes, anywhere we can get urine on the floor, anywhere we get water on the floor, we want to make sure that those areas are staying dry and clean. If we have uneven surfaces in the house, so if our house, we have a living room that's a step up or down from the rest of the floor, knowing where that uneven floor is, making sure we have good lighting, especially in stairs and hallways. Multitasking is one, and making sure that you're not looking at your phone, you're not trying to answer other people, that you're focused on the tasks that you're doing. Other things like fall risks for the obstacles and trip hazards can be our pets and our loved ones, but then also just clutter in the house. After we've identified these fall risks, then we want to take care of them and make sure we are preventing those fall risks from happening. So making sure that we have a good setup for stairs, handrails on both sides or at least one side, picking up clothes or clutter in the rooms to avoid trip hazards and obstacles, making sure that you are decluttering the kitchen, the bathroom, making sure that we're using a non-slip surface or we're drying and cleaning where we are. And then the big one is staying healthy, making sure you're having your annual physical with your doctor, you're getting your vision checks yearly, you're asking about medications that you're on and how they're going to interact with other medications that you're already on. Making sure you eat a healthy diet, and then exercising regularly and making sure that you're wearing shoes that fit you properly. It's going to give you the best information from your feet. Start where you are, use what you have, and do what you can. Arthur Ashe. So we want to improve our balance. So balance is kind of made up of three big ideas. There's a lot that goes into balance, but the three main ones are our vestibular system, which is basically the input that we get from the inner ear. So people have talked about vertigo, that deals with the vestibular system. Anytime we have an inner earache, anything like that, think that it's going to mess up your balance. The visual system, so again, sensory input into the eyes. So if you are out on a boat and you're watching the waves, you're seeing movement, you might feel a little more unsteady. But granted, the boat is moving as well. Maybe you're on the pier and you're looking, you might feel a little unsteady as your eyes are kind of having a moving background. Proprioception is just a fancy term for the information that we get from our joints, muscles, and skin. So that's why proper footwear is so important. Whenever we stand, our feet get information from the ground, our ankles get information from the ground, our knees, our hips, all the way up, and everything is telling the brain where we are, what kind of surface we're on, and how to best have good balance. So how do we improve our balance? We're going to practice, practice, practice. We've got vestibular ocular reflex, which is basically how your inner ear and your eyes work together. So we've got exercises for those. Some of them are as simple as looking at your finger, trying to watch your finger as you turn your head from side to side. That finger should stay nice and clear. To make it more challenging, you try to go as fast as you can, keeping a clear finger. We can also do up and down on diagonals in front of a calm background, a busy background. There's a lot we can practice there, and that would be something that your physical therapist would go over with you, or we can talk about at the end of the presentation. Proper fitting shoes. We want to make sure we have that best proprioception. Compression stockings. Again, that can just help with proprioception. If we have swelling in the legs, having that compression stocking can help give a better input to those muscles and joints. Practice proper posture. So if we're standing and we're hunched over, we're now bringing our weight over our toes. We don't want to fall forward. So standing up tall, shoulders over your hips, over your ankles. Go slow, walk with purpose. Make your turns with purpose. Stand up with purpose. And then strength training. Getting stronger will help your balance. In the pictures, you see them practicing a single leg stance. You can do it at a chair, at a counter, at a table. You just hold on to something, lift one leg in the air. If that gets easy, just use fingertips only. If fingertips only are easy, take off your hand, but stay near is perfect. Practice that. Another one for strength is the three-way hip. So you can stand, counter, table, chair, walker, hands on. You don't have to hold tight, but hands on. And you're practicing kicking forward, kicking backward, and to the side. Strength doesn't come from what you can do. It comes from overcoming the things you once thought you couldn't do. Ricky Rogers. So why is strength so important? Number one, it prevents bone fractures. It increases muscle mass. It improves functional movement, and it allows us to have a better body composition. Strength training has been shown in the research to have benefits for mental health for our seniors. So how do we improve strength? Practice, practice, practice. We want to focus on anti-gravity muscles. So what does that mean? That's those muscles that help us stay up tall and that help us get up from the ground. That includes our neck, so the back of our neck. We don't want our neck out here. We want it up nice and tall. Our paraspinals, which is, again, same thing back here. So instead of being here, we're up here. Our hip extensors, again, so we're not leaning forward. They help keep us up tall. And then our quads and our calves, those help us stand up and walk. Knowledge is power. If you know what you want to work on and you know what you need to strengthen, it's easier to train. Train, don't strain. So we want to make sure we're practicing safe techniques. Don't go to the gym and lift 50 pounds if you haven't been to the gym in 50 years. Start light. Don't strain your muscles. Work on slowly building them to be stronger. And then going strong, just committing and practicing daily for at least 3 to 5 times a week. One step at a time is good walking. Chinese proverb. So when we talk about gait training, we want to take safe steps and we want to use assistive devices. It's really important that as we're walking, we're adapting to our terrain. So knowing if it's a flat linoleum, if it's carpet, if it's bumpy gravel or grass. Shock absorption. That's the importance of when we hit our heel first and load onto our foot. When we hit that heel and start to load, it absorbs the shock. When we walk, we have to be able to balance on one leg as we lift the other foot to carry through. That is single leg stability, which is balance. Progression, just making sure that we can come forward to take that next step without falling. In order to walk successfully, we have to have normal hip, knee, and ankle range of motion. We need symmetrical limb cadence and equal step length. All that means is that you're walking at the same speed on both legs and with the same length. What we see is when people are lifting, you'll see them take a nice normal step and then a quick step. We don't want to see that. We want to see a nice even step. Weight shifting and weight bearing during loading. So just as you're walking onto your foot, you're shifting from the back of your foot to the front of your foot. You're also getting some side to side as you take the weight off of one leg and transfer it onto the other. And then making sure we're swinging our arms as we walk will help with our range of motion in our upper body and help with balance. So safe walking tips. Number 1, use your assistive device and use it properly. If you feel unsteady, it's great to have that assistive device, whether it's a cane, a walker, or a crutch. Make sure you have your good shoes and comfortable pants that aren't too long. Walk at your own pace. It's okay to tell somebody that you need to slow down or that you need to rest. You have to go at a safe, comfortable pace for you. And then don't carry heavy objects if you don't have to. Lifting strategies. So the most important thing when you're going to lift is make sure you plan out the task. So think through your task, decide where you are having to lift the object from and where it needs to go. Ask someone for help if it's too heavy. Don't try to lift it on your own and risk falling. And figure out, is it possible to lift it in separate parts? Do you need to carry this heavy bag, or can you get another bag and carry 2 lighter bags? The golfer's pickup is for a very lightweight object, such as a pen, a golf ball, you dropped in a water bottle, something light. What you're going to do is you're going to hold on to a surface. So you've got a chair, you've got your walker, you've got your cane, whatever it may be, and you need to pick up scissors from the ground. You hold on, straight leg is on the ground, the other leg is going to kick back as you reach down, and then right back up. Keep your back straight. Use the opposite leg as it comes off the floor. Balance, hold on to your object, whether it be your chair, your walker, or your crutch. If you have to lift from the floor, you need to lift and start in a safe position. To maintain the natural curve in your back, use your legs, squat, kneel, and let the legs do your work. Don't quit. So now you have a heavier object on the floor, and you have to pick this up. You're going to get close to it. You're going to try to squat down, grab the object, keep it close, and stand up. You can also do a kneeling position. So you get close to the object, come down, pick up the object, and stand up. If it's too heavy, ask for help. Carrying strategies. Think through your task. How far are you having to carry this item? Is it heavy? Do you have to use 1 or 2 hands? Can you get help? Do you have to go up and down stairs? Do you have to go on uneven ground? Can somebody help you? For one hand, light objects. Keep it close to your body, bent elbow. That way you can keep walking. Hold it in the opposite hand as your assistive device. So your assistive device here goes in the opposite hand. That way you can keep using the device safely. If you use a walker, hold it in your stronger hand. That way you can still hold on to the walker. If you have to carry with both hands, think it through. Are you sure that the weight of the object is okay for you to carry without an assistive device? Keep it close to your body. So you go to lift and carry this object. Keep the object as close to your body as you can. Make sure you've got a good grip. You don't want to drop it and try to catch it. That's going to throw your balance off. And maintain good posture. If you're holding this, you shouldn't be out here. You should be nice and tall. So to review those fall risk or fall statistics, 1 in 3 people will fall each year after the age of 65. After the age of 75, someone will fall every 2 years. After the age of 80, someone will fall every year. Deaths due to falls are higher among men than women. The difference increases with age. More women than men will experience a slip and fall injury. And floors and flooring materials are involved in over 2 million falls per year. To make sure that we're keeping our floors clutter-free, that we're making sure they're clean and dry, we're using our assistive devices and we're taking our time. 3 million ER visits and $50 billion each year are used because of falls. 5% of falls result in a fracture. 95% of hip fractures are due to falls. Falls are the most common cause for a traumatic brain injury. Over 15,000 people over the age of 65 die per year due to falls. Falls are the second leading cause of injury-related death among the 65 to 84-year-old range, and the first leading cause of injury-related death among those over 85. In summary, practice, practice, practice. Practice your balance and strength training. Practice walking safely and with purpose. Plan ahead. Know where you have to go. Know where you have to lift. Know what you have to carry. Ask for help. Make simple improvements around the house to reduce fall risks. It's really important that we have grab bars where we feel unsteady. And the bathroom is a big one. If you have to step into a tub, if you have to push off from the toilet, have those grab bars to keep you safe. Talk to a health professional about your concerns. If you have concerns about falling, talk to a health professional. That can include your primary care physician or your physical therapist. Talk to them about your concerns about strength and balance, and talk to them about your medications. Take your time. Go at your own pace and do what you need to do. Thank you so much for coming to this presentation. You have the handout. We're going to have you fill out the survey towards the end. You have your own home exercise program. And if you have any questions, let me know.